it continues to be another lovely moment here at your number one TV station. That is Imani Television, the station that continues to build your faith in Christ Jesus. With me, your host, Kageni Shilo Zedita. Good morning, my lovely viewers. I hope you're having an amazing time because personally, I am having a blast from amazing cover songs to amazing discussions because right now we are going to be diving deep on matters dealing with mental health, and we are going to be addressing our topic that I was able to introduce, that was alcohol use disorder. So ensure that you're with us from the beginning of this wonderful and amazing segment until the very end. And from there, I know we're going to just have a blast and be educated on it because my guest is going to be taking us through an understanding of what it is all about. So ensure that you're with us, ensure that you follow us through all our social media handles at Imani Television on Facebook, Imani Television on YouTube, not forgetting our SMS line 0746 780588, 0746 780588, telling us exactly where you're watching us from and also what questions what questions will you like to ask our expert today. So ensure that you're with us until the very end as we dive deep into this amazing program. Having said that, let me give this opportunity to my guest to introduce himself, and from there I know we'll continue with the discussion. So karibu sana, welcome so much.
Thank you.
Can you please introduce yourself to our viewers back there?
Thank you, Sandra. Hi, viewers. I'm Vincent Wekesa. I'm one of the members of the Afya Care Foundation. I'm glad to be here, and I think you will enjoy the show. Thank you.
Okay, thank you so much, Mr. Vincent, for being present with us.
Thank you.
And now, let us just kick off this discussion. I was able to tell them that today we are dealing with alcohol use disorder.
Okay.
How can we define alcohol use disorder?
Thank you. Now, before we come to definition of alcohol use disorder, we have some terms that we need to understand.
Okay.
Number one, we need to understand what's alcohol first. Then from there is when we can define, we have other terms that are related with alcohol.
All right.
Now, when you talk about alcohol, they are just the direct fermentation by the action of the yeast. Those are the sugars.
Yes.
It's just the fermentation of the sugars by the direct action of the yeast. Now, the product that you will get is the one that's called alcohol. And then for this alcohol, we have some terms. Before we come to alcohol use disorder, we have some terms like addiction. We have some terms like alcohol dependence. Now, when we talk about alcohol dependence, for example, we mean, it comes from the word dependent. The word dependent itself, it means you cannot do without. It means you are relying on something for another thing to happen.
Yes.
Now, alcohol dependence, it means you are relying, your body system or your body chemistry cannot function without alcohol.
Yes.
That's what is called alcohol dependency.
All right.
Now, when you talk about alcohol addiction, what does it mean? It means just physiological and behavioral, characterized by impaired ability for you to stop using alcohol, despite knowing the dire consequences. It means you know that when you are drinking, you will get maybe a certain negative effect, but you will continue to drink. That's alcohol addiction.
Okay.
Now, alcohol addiction and alcohol use disorder, they rhyme. They go hand in hand.
Right.
All of them, they are the drinking patterns, whereby someone is taking alcohol, that person may know the consequences, may know the end results, but he will continue to drink alcohol.
Okay.
That is alcohol use disorder. And if you try to stop, it becomes very difficult.
So it leads to addiction.
It leads to addiction. It starts with addiction.
Okay.
And then dependency and AUD will come as the second and the third.
Oh.
Then for alcohol addiction, that majorly or specifically it begins with the teen or the teenagers. Then AUD majorly attacks those people that is 20 and 30s. Kuendelea.
All right.
Okay, now that is the difference. Under this alcohol use disorder, you may know that someone can be addiction, can be dependent, but under AUD is where that's the normal characteristic that I know we'll talk about it. But you will see this person, if he's a man or if he's a boy,
Yes.
he can drink up to 4 drinks within 2 hours.
4 drinks
4
within 2 hours.
within 2 hours.
Okay, and that will the percentage matter? Because I believe there's some percentage when you're talking about alcohol. They tell you normally that this is 40 or 20. Will percentage matter in that bottles or 4 bottles in 2 hours?
The more you take alcohol, you get intoxified. When you talk about intoxication, I mean,
Okay.
more of the blood system will be alcoholic,
Okay.
and it can lead to something called a blackout.
Oh.
I know I will talk about it when it comes to health effects. When we talk about a blackout, this is someone who may not remember what you have just said a few seconds ago. So it matters a lot. Yeah.
All right, that is quite interesting, and thank you so much for that introduction.
Thank you.
It is good for us to debunk all these terms, so that when I'm asking in regards to what other questions in regards to this alcohol use disorder, we are able to understand from which point are we coming from or why that question is asked. So thank you so much for that. And I would like us for us to move on to how is alcohol use different from the normal or occasional drinking now? Let me ask that.
When you talk about alcohol use disorder, we mean that you know that you are going to be affected.
You know.
This is someone who is smart. He knows that when I drink this, I'm going to be affected. But he continues to drink. That's alcohol use disorder.
Okay.
The other term, for example, alcohol use minus that disorder, someone may not know. Maybe that person may be drinking out of peer pressure. That person lacks the knowledge, but just goes on drinking. But under disorder, you know it very well.
You know that this
you know that even if yes, I know, for example, one of the effects that we talk about, you have something called hypoglycemia. Hypoglycemia, it means the low blood sugar.
Right.
That will result from the action of the liver, that is. You know it very well. Or let us talk about the simple terms like cancer. You know that when I drink this, I am increasing the percentage to get this cancer disease. But you go ahead and you drink.
Okay.
That's alcohol use disorder. But for other terms like alcoholism, when you are drinking alcohol, that one you may not know. Yes.
All right. Thank you so much. And now, what are now the warning signs? Or, yes, indeed, the early warning signs of alcohol dependency?
When talk about the signs, it means number one, this is someone who cannot control drinking.
They cannot control?
You cannot control drinking. You drink anyhowly.
Oh.
And if you try to control, you will be unsuccessful. You can't manage. That's number one. Number two, this is someone who has strong cravings for alcohol. When we talk about craving, that's extraordinary appetite. Whenever you sit, you just think of alcohol.
Like you can just be even in a meeting, in a room, somewhere where alcohol is never a part of that room, and then your mind is just...
And your mental is affected by alcohol.
It's just
no alcohol, you cannot even maybe think of something else.
Really?
Yes.
So you have to have something before you...
Hey, these are menace that we are talking about.
Oh my.
This affects most of our... I am very sure when you open the question side, might confess. This is a menace that it might start as a joke.
Actually, true.
But at the end of the day, we have a dire consequences. Now, number three, I've talked about now how will you know that someone is under AUD. Number three, have something called withdrawal symptoms. Withdrawal symptoms.
Okay.
When I talk about withdrawal symptoms, this someone, yes, that person may have that wish to stop using alcohol.
All right.
But the moment he will stop using that alcohol, he will start to show some signs. For example, the signs of vomiting, nausea. Those signs, those are the characteristics. And you want to stop, but it becomes very difficult.
Okay.
You will be you'll be caught up with those signs. That's called alcohol. What? Alcohol... I talked about alcohol tolerance. When we talk about alcohol tolerance, we mean you have that strong urge or that strong feeling to continue using this alcohol so that you get the better feeling that you want.
Okay.
And you drink, unakunywa, tena kesho ukunywe zaidi ndo upate ile uwezo yenye unataka kupata.
Your feeling
yenye unataka, that feeling. Yeah, you continue to drink. So those are one of the signs. Then we have the others like someone may reduce the social function so that he may attend or she may attend to alcohol. Yes.
So they refuse to go for functional social events just so that they are able to just drink.
Or you are just off, you are on, you are off, so that you create that time. At least you take some alcohol.
Okay.
Then someone may start to take it at an early age. Maybe that's exposure too. But I think those are the symptoms that we talk about, I think, in our next question.
Yes, because actually, I know you can just now move on to the symptoms. And also maybe the causes. Does that fall under, what are the main causes and risk factors in regards to alcohol addiction?
When we talk about the cause, it means what is it that is leading you to do this thing?
Yes.
Number one, we normally come from different villages or different societies.
Right.
We have some cultural beliefs and some social beliefs, if I may say.
Okay.
It's believed that, for example, if you are having a certain celebration in your home, you may take some time and then you do it. You come up with alcohol or you ferment the alcohol.
Okay.
That's where it will begin. Then I'm sorry, I'm a teacher, by the way. So if I use the word learner, if I use the word learner,
personally I'm learning and my viewers are learning.
It's okay.
Yes.
Now you will realize that this person will growing up knowing that taking alcohol is not bad.
It's normal. It's okay.
It's just normal. That's number one. Okay. Number two, we have availability and accessibility of the alcohol. Okay. You know, something can be, alcohol can be available, but you cannot access it. But these are two terms. You know it's here, but you can access it. You can take it.
Okay.
For example, maybe you are walking in our village, you see that Boma A has alcohol, Boma B has alcohol, and then that Boma A, you are just allowed. They are not restricting restricting anybody. So you can go there. You take your alcohol, whatever you want, then you start to drink.
Okay.
Then we have some other like the medical condition like trauma. When you talk about trauma, it means this is someone that passed through a painful moment.
Right.
Now, this person, some, not all, some may resolve that. Now, for them to forget that painful moment, let them resolve to alcohol. Okay. So that they convince themselves that when you drink alcohol, then you will do what? You will forget those painful moments.
Yes.
Yeah. Those are among the causes or what may cause. Then you have that drinking it at early age. Someone starts to drink peer pressure, starts to drink from an early age. Then when he grows up, that person knows that drinking is not bad. It's something that is just normal.
Okay.
Yeah. Then we have some to do with the parenting also.
Parenting.
Really? That's the history of the family.
Okay.
Under the history of the family, for example, you can have some parents that are taking alcohol, but the way they are taking alcohol, they are exposing them to that to their children.
Okay.
Now, the children, in Kiswahili we normally say, mtoto akibebwa si anatazama kizoko ya mama yake ama ya mzazi wake. Sasa mtoto he grew up knowing that drinking is not bad. After all, my parents are taking it. So and they are my role model.
So they do not question.
They do not question anything.
You know it's bad. No, they're like it's normal.
It is something that is just normal. Then they grow up taking that alcohol.
Okay.
That's how it will result to AUD. Yeah.
Okay.
Yes.
That is quite a handful, but it's quite relatable because when you look at the society, ama tukiangalia mazingira, sometimes in affect watoto wetu, kwani unapata mtoto mleavyo ndivyo akwavyo. So ukimlea akiangalia aone hizi ni vitu za kawaida kama mzazi, hata yeye akiwa mkubwa bado ataona ni ya kawaida.
Tena ataanza kutengeneza. Anakuwa expert. All right. Then under that, when wanasema we normally have this thing called hybrid. When we talk about hybrid, it means whatever that you are doing, your children will do it more perfectly than you. The offspring now. Yeah, that's how it will. If you are taking, for example, let us talk of 2 classes of Changa, these local breweries. Then your child may start taking around 3 kupanda.
Yeah. That is quite.
Atakushinda.
That is quite unfortunate. And I think parents out there are very, let us be cautious as parents. I
Yeah.
hope you're listening to us keenly because we're getting knowledge on this term and we've been able to just get an understanding of what alcohol use disorder is all about. We've been able to get an understanding on the causes and risk factors, what basically can cause for someone to do it. And as a parent, if you feel and if you see that your child is in such in such an environment, it is very much advisable that you should stop doing it because mtoto wako amleavyo ndivyo akuavyo, and later on you'll be asking yourself and wondering, why is my kid not, mtoto wangu anatumia hizi vitu, ni alcohol addict and so forth. So until we analyze, please self-analyze your home states and so many other areas of your life. And as we continue the discussion,
Then just a minute, my presenter.
Yes.
There's a point that I would like to stress under the causes. We have something called depression.
okay,
Yeah, depression. Under depression, this is whereby someone is low. Isn't it? Huh?
yes,
When this person is low, and then he might resolve to drink so that he becomes normal. Isn't it?
yes,
That small mistake that you are taking of drinking so that you become normal, it's not, you are not helping yourself. But what you are about to do, you are about to commit a serious problem in future.
okay,
That small thing that you say that let me wacha nikunywe kidogo
Nisahau.
nisahau ama kutoa long.
Nitoe-
It's one of the causes, and this is the serious cause. Someone anakwambia, sometimes you normally talk to these people, then you will confess that mimi kukunywa, it was not my wish. I was having this mood, so that I decided to drink so that I move to the another mood,
Yes.
which is normal. Then at the end of the day, that person becomes addictive. Then from addictive, you graduate slowly to dependence. Then from dependence, you will find yourself under AUD. Yeah. So those people who have depression, alcohol is not a treatment. Alcohol will not treat you depression. Depression will only be treated when you visit our hospitals. Yeah.
Okay. And when you were talking about that, how does alcohol affect the brain and also decision making?
When someone is under influence of alcohol, number one, all the systems will not function normally.
Okay.
Will stop to function normally. We have something called slurred speech. This is someone who does not even know himself. That's number one. You may acting things not because your brain is engaged, but because maybe you are under influence of alcohol.
Okay.
The best example, if someone has drunk, isn't it? Atafanya vituko mingi sana. Mwachie tu afanye hizo vituko if he is drunk. Then from there, after amemaliza hiyo, now that drunkenness imeisha,
Yes.
muulize, what were you doing? That person will tell you, hakuna kitu mimi nilifanya. What does he tell you? He tells you that whatever that he is doing, his brain is not engaged at all. The central nervous system has been disconnected completely.
So he's just like a totally different
The brain
person.
cells have been disconnected. He's operating under something else, but it's not maybe within the brain. But after the recovery period is when he will tell you, oh, I'm sorry. I was not even myself. That's how it affects the brain.
Okay.
I think let me just talk about the effect now, since
It's
we have
okay.
begun.
Yes,
Now,
absolutely.
under the effect, there is categorized into three. We have the social effect, we have the health effect,
Okay.
and then we have the economic
Economic.
effect.
Okay.
When talk about social effect, the social comes from the word society. I and my people surrounding me. What is it that is going to affect them possibly negatively? That is social. The health is you yourself.
Okay.
What is it that's going to build inside your body that maybe perhaps at the end of the day you'll have to seek the treatment?
Yes.
Then the economic is all about your finance. How are you going to finance your drinking habit? Where are you going to get that money?
Because you won't be able to work.
Yeah, that's now the economic. Now, when we talk about the social effect, as I said earlier, it's all about the society. How are you going to relate with your people? One of the serious issues that will lead, that has the social effect of this AUD is number one, if you are married, you have something called erectile dysfunction. Under erectile dysfunction, this is a man mwenye hastahimili kwa muda mrefu.
Okay.
I know you understand.
Yes.
It cannot. Now, if that erectile dysfunction will come into your marriage, then it means divorce will also be knocking.
Yes.
Around the corner too. Then at the end of the day, someone may divorce the wife. Then you have it leads to breakage of the marriage.
And also, when you're talking about that, we also look at the aspect of the side effect in terms of the children. You know, one partner may decide, you know what, let me remove my children from this situation. I do not want them to be around such a parent or a guardian who is an alcohol addict. So it's quite interesting.
And then number 2,
Okay.
then we have other problems like fighting. And I have talked here some few moments ago that this is a man who does not understand himself. He may result to what? Fighting with others. Then we have unsafe driving.
Yes. Okay. Absolutely.
I will not say it, but we normally have some of these brewing companies. Hata pia wanasema usikate maji na uendeshe na udrive.
Yes, don't drink and drive.
Don't drink and drive. They are warning you.
Yes.
So if you take that alcohol and then you drive, what do you expect?
Accident.
That is it.
Yes.
Then we have also the social conflicts. That is, I have talked about maybe conflicting with people. Then we have this one that's called legal at the what? At the office. Legal conflicts.
Okay.
You know, this someone who is an addict. He will come in the office. After 2 minutes, he's out. 3 minutes, he comes again. Another minute, he's out. It will bring to conflict with the employer.
Yes.
Atakuuliza, you know, in the companies, I know here we have some rules and regulations that we need to follow.
Yes.
One of the rules maybe it can be you stay from this time up to this time. You need to be working.
Okay.
But at that time, that person is not working.
Yes.
What do you expect? Legal conflict. If you are in teaching profession, that can lead to interdiction. Yeah. So no, those are the social effects. Now, when you come about the health effect, I say that health effect, it's you yourself. Now, your body system inside you. What is it that is gonna trigger?
Yes.
Number one, it will lead to something called hypocalcemia. You know, I talked about it.
Yes.
Hypocalcemia, the liver will not be able to function normally to produce insulin hormone.
Absolutely.
We talk about insulin hormone, that's the sugar hormone, isn't it? Now, you will be lacking that sugar level inside your body. Definitely, you will have to seek medication. But the cause will be alcohol.
Okay.
Hypocalcemia. Then we have inflammatory of the stomach holes called gastritis.
Okay.
That one will lead to what? Problems to do with digestion. You will not be able to digest your food very well. Then we have heart diseases.
Right.
Like hypertension. That's high blood
pressure.
High blood pressure. Then we have the terms like the cancer. That's the liver cirrhosis. I know you have come across it.
Yes.
It's maybe because of this what? Alcohol. Yeah. That's under the health. Then under the economic, when we talk about economic, it will lead number one of extravagance. Extravagance, I mean, you will spend more than what you earn. You will
splurge because you're not in control of your mind or your body function or mind function. So you're just spending.
So if you are spending something that you do not have, what will you resolve? Or you want to do something that you cannot get. You will try maybe to violent means. Yeah. So you will have to do, or under your budget, you have to cut it so that it fixes your what? Your desire. Then vitu zingine you can even slash.
Really?
Kuna watu watazamaji watakwambia kuna mtu anauza hata mahindi. Aenda afanye nini? Anunue pombe kidogo. Those are the economic
and actually
effect.
And worst of all, or the worst thing of all, is that they will sell that commodity at any given price. At any low price, even if it's not the value of that thing. And you find that now for families out there, akiuza mahindi na huyu ni mtu ambaye ako na familia, watoto wanakula nini?
No, the person who is under this AUD is not even more important with the quantity or the quality of the product you want to sell.
Actually,
what he is interested in, he get that small coin. Provided itatosha aende akunywe. Final.
That is it.
Someone may even decide to sell, for example, these smartphones at as low as even 500. A smartphone of 1,000 or 15,000. Someone is selling us 200. So that 200, he just want to get and to have a sip of that alcohol. He's not even concerned about the quality. He's concerned about that thing that he's going to get. He have a short-term relief, then life goes on.
Okay.
You know, watu wengi hiyo hata inaleta watu wanagombana kwa nyumbani.
Yes.
You have put there your maize, next day haiko. Simu eleweki ilienda vipi. Maharagwe kwa store inadidimia.
Haya.
Those are the effects. Provide this person wants to do what? To tank.
That is quite unfortunate. Actually, it's very sad that we have such people in the society who are affected by this. And oh my, it's so sad. And I think you've been able to cover what my question will have been, and that was in regards to physical health problems. You've been able to mention them, and we'll not have a recap from that now. And I think we've covered so many questions in regards to it.
Allow me, Madam Presenter. We have this under the family breakages. I think we normally have this thing called in our home, called Chief's Baraza. If you attend those Chief's Baraza, if we have a divorce, I'm not saying all, but some. If you have a divorce case in your society or in your area, majorly or a bigger percentage, it's from alcohol.
Yes.
And the cases that you'll be hearing around that baraza, mostly is involved under alcoholism. So this is something that's affecting us directly, especially for these social functions. It's a reality.
Absolutely.
When you will be opening that portal of questions and some maoni, someone might confess. So let us be cautious. What I can say. These effects are there, and you normally see them. Or if you have not seen them, you have heard it from somewhere. So let us be cautious.
Absolutely. And don't be an example.
And don't be an example.
Yes, usitumike kama example.
Example.
Kabisa. I hope as my viewers, you've been able to learn one or two things in regard to alcohol use disorder. And you've been able to gain knowledge and understanding on it. And also to be very cautious, because this is something that we all know it affects us in one way or the other. It might affect you directly or indirectly, because that person might be your neighbor, and when items disappear and finishes at home, they will cross over to your place. So just ensure that you talk to them, they find help, and we're going to now be discussing on matters dealing with treatment. So ensure that you're with us as we continue to interact with each other through all our social media handles at Imani Television on Facebook, Imani Television on YouTube, no forgetting our SMS line 0746780588. But for now, let us just take this short break, and when we come back, we'll be now continuing with our discussion for today.
Majina yote mazuri ni yako, Jehova muumbaji wangu. Nikupe jina gani, kwani kila la kiheri ni upekee wangu. Majina yote mazuri ni yako, Jehova muumbaji wangu. Nikupe jina gani, kwani kila la kiheri ni upekee wangu. Umenionya na kuita Jehova Rafa, Mungu mponyaji wangu. Jehova Wewe ndiwe mchungaji wangu, tena kiongozi wa maisha yangu. Wanitazama kama mboni la jicho lako. Usifiwe ewe Bwana, Muumba wangu na nuru yangu. Wema wako wanijaza moyo. Wewe ndiwe mchungaji wangu, tena kiongozi wa maisha yangu. Wanitazama kama mboni la jicho lako. Umenifanya kuwa kielelezo cha waliobarikiwa. Zaidi ya yote ukanifanya kuwa baraka ili nami nibariki. Nimekupata na nikaridhika, wewe ndio tena ni ya yote. Mama, usifiwe ewe Bwana, Muumba wangu na nuru yangu. Wema wako wanijaza moyo. Wewe ndiwe mchungaji wangu, tena kiongozi wa maisha yangu. Wanitazama kama mboni la jicho lako.
Well, welcome back again here at your number one TV station, that is Imani Television, the program being The Daily Fix, with me, your host, Kageni Shilojidit. And today we are with Mr. Wekesa as he explains and gives us an understanding of what alcohol use disorder is all about. So ensure that you follow us from this moment until the very end as we continue to just dive deep into this amazing segment. I'm personally having a blast because these are things that unfortunately are affecting young people out there. As a young person, it is quite educative, and I hope each and every one out there, a parent, a youngster, will truly get an understanding of all this and also try to prevent their friends or even themselves from getting into such a condition. Example, alcohol addiction, and that we may lead now to this disorder that we are talking about, alcohol use disorder. So for now, let us move on with our discussion, and we are almost winding up as we are moving on to treatment and recovery questions now. When we are talking about treatment, what are the available treatment for someone who's having such a disorder?
Thank you, Madam Presenter.
Yes.
Just the way I said, you know what is it, AUD?
Yes.
When talk about treatment, you only treat something that you know the root cause. It will become very easy for you to treat if you know the cause.
Okay.
Now, the treatment basically is the opposite of the cause.
The treatment is the opposite
basically
of the
the
cause.
opposite of the cause.
Okay.
That's the treatment and control measures. But here are some. Number one, remember we talked about early exposure
Okay.
to alcohol under the causes.
Absolutely.
Now, when it comes to treatment, it's the opposite. Do not be exposed to alcohol. Alcohol has no any plus effect
Yes.
when you get it exposed at early age. Then number two, we have things to do with some social and cultural beliefs.
Yes.
You know yourself, what are they? Avoid them.
Okay, absolutely.
Just avoid them. Then you will be on the safe side. Then we have others like social support groups. Under the social support groups, what we majorly do, we want to do away with idleness.
Okay.
I know somewhere in the Bible, an idle mind is a
Devil's
devil's
workshop.
workshop. Now,
Saying that.
when we are going to give this youths busy with these support groups,
Yes.
then they will not have time to drink alcohol. At least most of the time they will be preoccupied somewhere else.
Yes.
Then we have another one, like maybe if it's so severe, you can come for treatment in our hospitals. You'll visit a nearby hospital, then you get treated. That's when it's under severe. Imekuzidi sana. Then we have alcohol therapy. When we talk about alcohol therapy, the way we are doing this is alcohol therapy. We're talking about alcohol. We are educating members who are seeing us, or maybe those one who are hearing us about the alcohol.
Yes.
From here, I'm very sure we have some who will change.
Absolutely.
That changing is also a treatment. Yes. Yeah.
So alcohol therapy, very important. This is what we're doing here, because we're learning and we're talking about it and the side effects and why there's no benefit. From the discussion generally, I've seen that there is no benefit.
There's no benefit
There's
at all.
no benefit in using alcohol, because the amount of loss that you will experience
Is more.
is more greater. So it's quite it's quite unfortunate, and I believe as youngsters out there, you will try at all costs, and not only youngsters, even the adults, you will try at all possible means to avoid it, and also do not allow any peer pressure or anything in life influence you into trying it or being tempted to have a taste of it, because kidogo kidogo tu, yani that is how you find yourself getting addicted to it.
Yeah. Then we have this fallacy, in quotes. We have this fallacy that from somewhere, especially where I come from,
Okay.
you'll be told that when you are having a southern disease, I think it was typhoid or something like that, utaambiwa onja tu kidogo inafanya nini? Inaponya.
Really?
Yeah. Nakwambia onja tu kidogo utapona. Ama kwa mfano kama uko na mafua, those are the things, and many others.
Yes.
That they will try as much as they can so that you get in touch with alcohol, so that maybe that problem that you are having may just evaporate like that. I'm here to caution you. There's no scientific research over that. If you are sick or you are having a certain disease or a disorder, just visit a hospital.
Okay.
You will get treated. Yeah, hizo vitu achana nazo.
Absolutely.
Yeah.
And that is quite interesting. Maybe just as we continue with the question, aside from that fallacy, is there any other myth that you may know in regards to alcohol?
Yeah, there are so many myths about alcohol. Wanasema ukikunywa unakuwa aire. Those are the words that they normally use.
Yes.
Ukikunywa unakuwa aire. Nasema ukichapa mboka I think ni kufanya kazi. Mboka itakuwa mzuri. Sasa kunywa ukwe sawa sawa. Hakuna kitu kama hiyo. That's just a fallacy and a myth and a misconception. Yeah. Someone may say that when you take this alcohol, when you want to calculate, I think some arithmetics, your brain will be very sharp. 1 + 1, you may even get an answer before even calculating. Those are some of the fallacies and the myths and misconceptions over there. Yeah, we have so many. I'm very sure if you open the comment section, watakwambia.
Okay.
They will say that, hata kwetu kwa kijiji yetu kitu kama hiyo. They will be able to tell you.
Actually, it's so true, and it's quite unfortunate, but thank you so much for that. And I think each and every person who is watching right now has been able to understand that is not the case. Kama umeweza kututazama na unatusikiliza, umeweza kufahamu ya kwamba jambo hilo si ukweli. Kwa hivyo usijaribu, usidubutu, hata usijaribu kudanganywa na mtu yeyote, ikuwe ni rafiki, ikuwe ni family member, ikuwe ni ndugu, dada, mtu yeyote yule, hata ule rafiki wa karibu ambaye unamfahamu, tafadhali onyo kwenyu. Now, when we're talking about, as we continue with the discussion and almost wind up this segment, we have challenges. What are some of the common challenges that people face after treatment? Let's say someone had this condition and then they get treated. What are some of the challenges that they may face?
Thank you. Before I talk about the challenges under that treatment,
okay,
I know this is Imani Radio, and we believe in a Bible.
Yes.
There is somewhere in the Bible, the verse that talks about alcohol.
And people misquote it. Actually, people misquote that.
it.
Yes, there is.
So, it also warns us against alcohol.
Absolutely.
Yeah.
There is a warning and
there's a warning somewhere.
Yeah, there is a warning and then there is a verse that people misquote on it.
Next time I will come with that verse so that all of us will read.
Okay.
So, tuachane nayo. Under the challenges that people may face, maybe, for example, you have been treated and then you are maybe on a recovery period, someone may get attempted to go back.
Okay.
That is number one. If, for example, you have treated this person, one of the causes yatakwambia, he was idle. Then amekuja umemtreat. Then you are exposing that person to the society. Maybe hana kazi. Unaona. Then it might prompt him or her. Afanye nini? Arudi.
Alright.
Aanze kukunywa. Those are one of the challenges.
Yes.
Then number two, where we come from. For example, if I'm from this family that is drinking alcohol, yes, maybe mimi nimejiamini kwamba wacha niende nitafute matibabu. Then after matibabu yote, then you are going back to the same society again. You might get tempted to go back from where you came from.
Yes.
Yeah. Among others. Yeah.
All right. That is quite interesting. And before I ask you for your closing remarks, because unfortunately our time is much spent, I like to give them the verses in regards to it.
Yeah,
we have
thank you.
Proverbs 21. Wine is amoki, and beer is brawler. Whoever is led astray by them is not wise.
I think, listen, I think our viewers are hearing what the presenter is talking. Kindly pardon.
Wine is a monkey and beer a brewer. Whoever is led astray by them is not wise. That is Proverbs 21. We also have Ephesians chapter 5 verses 18. Do not get drunk on wine, which lead to debauchery. Instead, be filled with what? The Spirit. That is the Holy Spirit.
That is it.
So there are a lot of things, but I think has told us, do not be led astray by them, by alcohol, beer, or any form of alcohol drink. And as we wind up this program, because unfortunately our time is much spent, what will be your closing remarks?
Yeah, sisi tumekuambia, mimi nimekuambia wachana na pombe. My presenter yeye amekwambia wachana na pombe. Kitabu kitakatifu kimekuambia kwamba wachana na pombe. So, wachana na pombe. Then this AUD is one of the menaces that is affecting so many people. So it's up to you as a viewer, regain yourself. If you have been taking, wachana tu nayo. Because it might start as a kitu kidogo, but at the end of the day, italeta kitu kikubwa sana.
Yes.
The problem will be so big. So just avoid as much as you can. There is no any benefit in consuming alcohol. Wachana tu nayo.
Absolutely. Thank you so much. It is quite.
Can I pick up some people? Can I say hi to some people? I was coming.
I think you can say hi as we wind up.
Yeah, I want to thank you viewers. Asanteni sana kuniangalia. And then I want to pick up the following crew. Number one, we have the Tuan Mission Hospital crew. Ikiongozwa na CEO Dr. Kalisa Swekesa mwenyewe. Asante sana, anafanya kazi mzuri.
Okay.
Then we have Bro Edmond is there. And Bro Edmond, we have Bro Moses. And everybody kina Sister Cherono. Na Kalista's driver mwenye amenileta. Asante sana. Then I want to say hi to my parents. That is Mr. Matayo Ekesa and Mama Gertrude. Is from a village that is in Bungoma County. Asanteni sana, Mungu awabariki.
It is very
and
much
then,
okay.
Finally, asante sana kuru yote ya Iman TV na wakurugenzi wake. Asante pia kwa kutupatia hii muda. Tunashukuru sana, Mungu awabariki.
Na sisi pia huku tunashukuru kwani umeweza kutupa mawaidha na tumeweza kuwa na discussion nzuri sana. Unajua si kawaida mzungumzie kuhusu mambo ya alcohol. People do not want to openly call out on addiction. Watu wanapenda kunyamazia chini ya maji, wasema usiongelele, lakini siku ya leo leo ningependa kukushukuru, umeweza kuwa baraka. Thank you so much.
Asante.
Unfortunately, our time is much spent and we have to wind up this amazing program. If it was possible, we'll have continued and break down more in aspect of the alcohol use disorder itself. But for now, let us just wind up this amazing program. And I hope as my viewer, you have been blessed. So stay tuned here at your number one station for more amazing program. But for now, I would like to wish you a blessed day ahead. I have been your host, Kageni Shiloze Dita, the show being The Daily Fix. Bye bye. See you tomorrow.